Good morning, guys. Today we're going to be doing our second autism remedy that's most commonly used in this clinic in our series of homeopathic medicines we're going to be talking about for autism. And my whole goal for these lectures or these little mini series is to give you guys an idea of what we look for to prescribe a correct homeopathic medicine when it comes to children with autism, because in homeopathy we have many remedies for autism that will help with the signs and symptoms of autism, okay? Once again, I'm going to say homeopathy does not cure autism. It does not treat autism. It is very simply a stimulus, very specifically chosen for the child to get that body's child to do the healing itself, okay? So, and I always relate it to this. If you had a stack of dominoes, homeopathy in the proper selected remedy pushes that first domino over, okay? Now the rest of those dominoes will fall over all on their own just by that first domino being pushed over. The remedy is that first domino. It is a stimulus to get that body to start the healing response. But the remedy does not do it itself. It does not cure, it does not treat. It is just a stimulus, okay? So, we just had a couple great cases of responses in two autistic cases that were given this remedy called Mercurius syllabus. And it was quick once because we were able to find the correct medicine right away. So the responses were fairly quick, slow and gradual still. These cases are not done. They still need months of treatment, but the promising results were very quickly shown within 2 days. So every case is unique. Once again, I have to say there is no guarantees. Some cases will take months, some cases will take days, some cases will take weeks. It's very unique to each individual case, okay? So let's talk about the symptoms, the key indicator symptoms of the remedy Mercurius syllabus when we prescribe it for autism, how it's prescribed, and typically what we see as a result of it. So let's talk about the number one thing that is a big indicator for mainly this medicine, and it is two things, and this is super common with kids who are diagnosed with autism. You will have excessive drooling, okay, a lot of saliva production in the mouth, so much so that it comes out of the mouth. It soaks the shirt. At nighttime in bed, the pillow will get soaked. It's generally more prominent at nighttime during sleep, but can be any time of day. So we have this excessive saliva production with these children, okay? Number two, you have foul odor from the mouth. Doesn't matter if you brush your teeth, this odor is an abnormal odor that is accompanied by the extreme saliva and drooling of the mouth, okay? So when you see saliva and extreme drooling and foul odor, Mercurius comes to the top of our mind as homeopaths to help these kids with autism, okay? Now, along with that, you may or may not see mouth issues. So you may see ulcers, you may see canker sores, you may see puffy, inflamed gums like gingivitis. You may see bleeding of the gums. Even if you brush them lightly, you may get some bleeding of the gums. This is another huge indicator of the remedy Mercurius syllabus, okay? So that's one of the main things we look for. Some other little common signs. Now, it will have the common symptoms of autism. So a lot of times there is stimming. A lot of times there is nonverbal. Things like this. This remedy does have that, but we look for the subtle little things in this remedy that are unique and subtle in the child with autism. That makes his case of autism unique from the other 9 cases we've seen, okay? For Mercurius, that's what it is. Now, we also, a lot of times, will see aggression. A lot of aggression, anger, a lot of defiance, you know what I mean? So if you tell them to do something, they will say no and they will throw a tantrum and they will not go. So they'll hit their brothers and sisters, they'll hit siblings, they'll throw chairs, a lot of violence, there's a lot of aggression. So Mercurius, the child with autism that needs this remedy typically has that, okay? What else do they have? That's pretty much it. Sometimes they could be constipated or they could have diarrhea, but they usually, sometimes they will have green stool, or they have a history of green stool, abnormally green stool as a child, okay? That's another thing. So that's basically it for this remedy. Mercurius is a remedy we use a lot of here, a homeopathic medicine we use a lot of here. When it's indicated, we don't just throw medicines at kids. We look for the signs and symptoms from the body. The body communicates to us what medicine it wants to start that healing response, okay? And it's through signs and symptoms the majority of the time. So these are the signs and symptoms and key indicators of the medicine Mercurius syllabus for these kids with autism, okay? And when the right medicine is given, the response is usually quick. Now, obviously, there's no guarantees. Again, I have to say that. but when the case is clear like that, they usually respond well. So just a little bit of information for you guys. My job is to educate you guys and to let you know that there are solutions for these kids. A lot of these kids will benefit from homeopathy, classical homeopathy, okay? So if you have any questions, give me a call. I would love to chat with you. We'll go over your case. I'll talk to you about your child. I'll let you know how we could help. I'll find out what you're dealing with. And I'll just explain the whole process to you, and then you decide if this is a good fit for you. We treat all over the world through Skype consultations, so distance isn't an issue, okay? And then we go from there. So if you have any questions, give me a call. I hope this video was helpful, and I wish you guys all the best, okay? Cheers.